Variant that is now circulating, especially in the Americas, that's called a BA2 subvariant. This is still um, the Omicron variant, but there is a subvariant that is circulating that is called BA2, and there is even a subvariant.
That was Health Minister Dr. Frank Anthony, who was at the time speaking during his daily COVID-19 update on Friday. The BA.2.1.1 subvariant, one of several variants of Omicron that are driving an increase in COVID-19 infections in the United States in recent weeks, is now responsible for nearly 58% of new cases over the last week. Minister Anthony said that a much milder but more transmissible subvariant of COVID-19 is probably present in Guyana and can cause hospitalization, particularly for persons who are older and unvaccinated.
But it is not causing as much hospitalization as previous variants. So we'll have to be on the lookout for this and to make sure that people take the relevant precautions.
The subject minister revealed that samples will be collected and sent to the Caribbean Public Health Agency, CARPHA, and other overseas health institutions to confirm the presence of the variant in Guyana.
We'd like to confirm what variant is circulating. So obviously we'll be taking samples and trying to verify with CARPHA and other institutions what variants are circulating.
The current number of active cases stand at 638 across the country, a figure that Dr. Anthony believes represents the gross underreporting of cases that is happening since people are falling ill but not reporting their status to the health ministry. He highlighted that the increased usage of self-testing kits at home is playing a possible part in this scenario. He also noted that since COVID-19 symptoms now mimic the flu, many people do not see the need to get tested. Even though mask wearing is no longer mandatory and all COVID-19 restrictions have been lifted, the health minister is still urging persons to take the necessary precautions. According to the U.S. Centers for Disease Control, CDC, BA.2.1.1 is a subvariant of Omicron and emerged from the BA.2 subvariant that has been a dominant strain in the U.S. since late March, and is one of the several subvariants of the Omicron variant of COVID-19. Most of the symptoms of the subvariant are the same as other strains of COVID-19, including a stuffy nose, body aches, sore throat, among others. According to the Health Ministry's vaccination report, 441,911 adults, or 86.1% of the adult population, have received a first dose of a COVID-19 vaccine, while 341,493 persons, which represent 66.6% of the populace, are doubly vaccinated. There are 25,414 adolescents fully vaccinated to date. Booster doses have increased to 64,989. Reporting for the AGP 19 News, Joel Vogt.